you're happy to help me move the patient into sternal recumbency, so on 3, I'm going to take the front if you're happy to take the back, and then on 3 if you're happy to help me turn him onto his tummy. So 1, 2, 3, thank you. I'm just going to make sure he's in the crouched position. And then if you're happy to help me to move him down towards this way, just so that his skull's in line with the tube head. So on 3, 1, 2, 3. Thank you. And then I'm just going to use some positioning aids. I'm going to use a sandbag over each limb. I'm going to use a sandbag just down the side of his body, just so that he's straight. I'm going to use a foam wedge just underneath the chin, just so that he's nice and straight. And then I'm going to use another sandbag just over the neck as well. I'm going to just make sure that we're all symmetrical, and I can use the nares and the sagittal crest as a guide. So just looking down the patient like that. That looks okay. And making sure the limbs are extended as well. And then I'm just going to measure the depth of the patient. So this patient is above 10 centimetres, so for this I would use a grid. And for this size patient I would use a medium sized cassette as well. So with my collimation, I'm going to collimate rostral to the nares, and then caudally to the atlas or caudal skull, and then lateral to the skin edges. And then I'm going to centre just between the eyes, just on the midline here. So that's my collimation centering. I'm just going to make the patient's label up. So it's going to have the patient's name, the date, and the patient ID. And that's just going to go into the collimation as well, where I can get it in. And then I'm also going to use my right-left marker and place that within inside the collimation as well. So this is the left side. Okay, so I'm happy to take the x-ray, so if you're happy to exit the controlled area with me. And then once we're in the safe space, we can take the x-ray. X-rays!